Alrighty, so my presentation is over Fibrodysplasia, Ossificans, Progressiva, and I'm not going to repeat it, or you can just call it FOP. So the definition of this is going to be, it's going to be a disorder of the skeletal muscles and connective tissue. The muscle ligaments and tendons are going to be ossified. Another word for this is heterotopic ossification. This is a very rare disease, and unfortunately life expectancy is only about 55 years old. So some symptoms: muscles and connective tissue is gradually replaced by bone. Malformed big toes, so this is going to be one of those telltale signs. It happens at birth, so you can tell this in an infant and be able to look into that almost immediately after birth. Immobility in neck and shoulders during early childhood, and this continues on to then loss of overall mobility. Trouble speaking and eating, so it's going to affect every muscle and every tissue, so anywhere you can think that you're going to have those muscles is going to be affected by this disease, so it will affect eating and speaking. And then muscle swelling and inflammation, this is another early sign. It may also occur even before the ossification starts, so you'll see these random flare-ups, and there's no exact connection on why these flare-ups happen with this disease, but it's just one of those things that happens throughout and in early stages of it, and then breathing difficulties as well. So assessments, we're going to have physical examinations, blood tests, imaging tests, bone biopsy is going to be really good for the assessments, and then genetic testing. Some causes, so it's almost always going to be a mutation in the ACVR1 gene. So this gene is going to be what's responsible for growth and development of muscles and tissues, or muscles and bones, excuse me. It's going to be inherited in an autosomal dominant fashion. So basically what this means is that the autosomal dominant fashion is one copy of a mutated gene and one copy of a normal gene in a pair of autosomal chromosomes. The autosomal part means that it's simply just one of the one of the chromosomes that is not the sex chromosomes, so the X and Y. And then the dominant is what we all learn in high school, so we have our dominant recessive genes. This is unfortunately dominant, so if there's only one mutation in that pair, it's going to take priority over that, say, normal gene, and that individual will contract this disease. So diagnosis, you want to find a specialist, imaging tests, lab tests for that verification, and then really important with the medical history and family history to see if there's been any past history of this disease. So treatment, there's no treatment, unfortunately. Surgery is going to be risky, but it does happen sometimes. Unfortunately, it's not going to do much other than temporarily reduce that bone ossification, and it is also very painful for that afterwards. Really helpful corticosteroids that are going to reduce that inflammation I was talking about earlier and the swelling. Other medications, so we got the muscle relaxants and then mast cell inhibitors to help as well. Then prognosis and follow-up, we're going to have frequent contact with that specialist and physician for constant checkups, monitoring symptoms, and then receiving education for symptom management. So those earlier stages, you're going to be living with that, so home care and understanding the disease is going to be very important. And then notifying physicians if, or I would better say when, symptoms worsen, because it is a progressive disease. And like I said before, life expectancy is only about 55 years old. All right, sources.